America has taken my breath away in so many ways, having beautiful places like this, for example, but nothing prepared me for the $2,000 that I spent on a simple tooth extraction back in 2018. This was when I was a grad student at Columbia University. I had insurance, and yet I paid more money than I would have paid if I had taken a round-trip flight to India, got the surgery there, and then flown back to the US. That's when I realized healthcare in America is a beast, especially if you're on a visa. Hi, hello, and vanakkam. My name is Soundarya Balasubramani, and I am an author, founder, and a full-time experimenter. On this channel, you'll see videos on how to study, work, and build in America, how to go through a creative process to create a book, a course, or something else, and in general, just how to be a global citizen and live anywhere across the world. This video is sponsored by Visitors Coverage. I'm actually on their plan right now for my health insurance, and they've been around for 17 years and helped tens of thousands of immigrants. So first and foremost, I want to talk about how expensive is healthcare in America? And here are some estimates. A 3-day hospital stay will cost you about $30,000. A heart bypass surgery, $70,000. And the same surgery in India will cost you $6,000 to $7,000. 10 times cheaper. And it's not because healthcare is 10 times better in America than India. There's so many factors that come into play to make America one of the most expensive countries in the world when it comes to healthcare. Here are 3 reasons why healthcare is so expensive. First is extremely high admin costs. In the American healthcare system, there's so many players. There's the clinics and hospitals, there's the insurance companies, and there's government programs like Medicare and Medicaid. And each of them have their own admin costs, which all add up and eventually go to the end user. Number 2 is extremely high medication costs. The US has some of the highest prescription drug prices globally, sometimes several magnitudes higher. And this is happening because there is very little, if any, price regulation at a federal level. So these pharma companies are monopolies that can charge anything they want. And third is a fee-for-service system. The US healthcare system operates largely on a fee-for-service model, meaning healthcare providers are paid for each test and procedure they run on patients. So sometimes they're incentivized to run unnecessary procedures even if it's not required. So those are just 3 reasons. There's many more that make healthcare so expensive. But let's talk about a more relevant question for you. Can you ever not have insurance in America? First of all, if you're on an F1 visa, you probably will have to have insurance through your university. That might be one of the regulations they have. And if you're on an H-1B or L-1 work visa working in the US, chances are your employer will take care of your insurance. In some cases, they have to. For example, if they have more than 50 employees. But keeping aside all of the regulation, it's never a good idea to not have insurance in this country because, once again, let me remind you of the costs. A visit to the ER for 1 day can cost you $10,000 without insurance. $10,000. That is some people's entire annual salary in India. And sadly, because you're an immigrant on a visa, you're not eligible for any of the public healthcare programs. However, everyone, regardless of visa or not, will get access to ER services if you get into an accident, for example. But you'd still have to pay the bill later on. So in all this maze, how do you choose a plan that actually protects you? Look at the following factors when you're choosing a plan. Coverage network. Make sure you have enough hospitals and clinics within your vicinity that are in network in your plan. Premium versus deductible. So premium is the money that you're paying on a monthly basis to keep your insurance going. And deductible is the money that you have to pay before your insurance kicks in if something happens. You want to make sure that you're in a very good balance in both of them. Don't go for something that is $10 premium because the deductible is going to be incredibly high if you ever get into an accident or anything happens. Emergency coverage. Always check for ER and ambulance coverage in your plan. Medication. If you have any pre-existing condition, know that drugs are not cheap in America and make sure that is part of your plan, especially for any senior citizens who are visiting the US on a short-term B2 visa. Vision and dental. I want to tell you a quick story here. Back in 2018, I was a grad student at Columbia University and I began having this toothache and it wouldn't go away for weeks. Eventually, I look in the mirror and I see a black dot in one of my teeth and I freaked out. I didn't know what that meant. So I go to the hospital. First, they tell me it's going to be a root canal and it's going to cost me a few $1,000s. And then another doctor that I went to said, actually, a root canal cannot salvage this anymore. You have to just remove the tooth entirely and extract it. So I went through the procedure and ended up paying over $2,000. That would have cost me less than $200 if I were to do it in India. So number 5, vision and dental, always check to make sure that that is part of your plan. If not, make sure to get it, especially if you have a condition. In short, don't just go for the cheapest plan out there. Look at what you're actually getting for the price you're paying. This is one of those instances where the fine print really matters. So a quick recap. Here are the green flags you should look for. Transparent terms, good reviews, US-based support, comprehensive coverage including hospitalization and urgent care. Red flags. cheap plans with high deductibles, limited network access, ambiguous language in terms and conditions, and also bad reviews. Finally, what if you just need short-term insurance? For example, I'm currently in the US on a short-term basis. I'm here for about 5 to 6 months. So I didn't need a long-term plan. That's why I went with Visitors Coverage. Visitors Coverage was actually started by an Indian immigrant, someone who came here decades ago and realized that there is not enough options for people who are coming here as an immigrant, especially on short-term visits. And so Rajiv started the company, and it has helped more than tens of thousands of people in the last 17 years. So whether you're visiting the US temporarily, you want it for your parents, grandparents, or someone else who's coming, or you just want short-term insurance, check out their plans. See, living in America can be a dream come true, but the problem is people don't talk enough about how expensive it can get, especially when you're sick. Whether you're here just to study, for a job, or just for a short family trip, make sure to get yourself covered, because the healthcare system will not protect you if you're not ready. So if you're ready to compare some insurance plans, check out Visitors Coverage or the link in my description. And before you go, if this was of any value, make sure to send this to a friend of yours and subscribe to the channel for more such videos helping international students, immigrants, and entrepreneurs. Bye.